The final thing I wanted to talk to you about was the way with both the anterior hip approach and these custom fit knees is how we treat the whole experience of coming into the hospital and going home. In particular, how do we control pain? This is what we call a rapid recovery program. The idea is to minimize the amount of toxic drugs, like morphine, that people get, right? In the old days when we would operate, and then the patient would make it to the recovery room, and we'd just hope for the best. And when they had a lot of pain, we'd flood the system with a lot of pain medicine. And as you know, these pain medicines are really detrimental to someone's ability to think, walk, act, and eat. So we try to minimize the amount of heavy-duty pain medicines that we use by using this kind of a program which we call rapid recovery, where before the operation, folks get some pills, right, that operate. They're pain pills that work by different pain pathways. During the operation, we inject the local tissues with an anesthetic, right, which is like Novocaine, so that when folks wake up, they're not in a tremendous amount of pain. And finally, after surgery, we put folks on scheduled pain medicine, so we don't wait for the pain to get bad before someone asks for the pain medicine. In this way, we can get folks to walk on the same day as the operation, almost always. They also have no restriction, wear nice clothes, don't have to wear those hospital gowns because we have no IVs or catheters or hoses, so people can wear their own clothes and really get home. And folks go home instead of going to another institution, from a hospital to another institution. Almost everybody goes home. At least 87% of people go home within 2 days after the operation. So this, when I first started doing this operation, folks would stay in the hospital for 10 days. And for those first 4 or 5 days, they were laying on their back with tubes and catheters and drugs coming in. Now, all the tubes and catheters are gone. Folks walk the same day as the operation, certainly the next day, go home in a couple days, and then have the visiting nurses and therapists come to the house to initiate the rehabilitation. Thank you very much.